You've seen them, right? Those top 10 lists of what's most likely to kill us, they pop up everywhere. But have you ever really stopped to think about where they come from? Well, it turns out the story behind those numbers is a whole lot more complicated, and honestly, way more revealing than you might think. Let's dig in. Right, who actually decides that heart disease gets the #1 spot? Is it just a matter of counting up all the deaths? Or is there, some kind of official process, a set of rules that actually shapes how we view life and death in this country? Well, it turns out there is an official rulebook. Ranking the leading causes of death isn't just simple math. It's a whole standardized procedure that was put in place way back in the 1950s. Today, it's all managed by the CDC, and even they admit that the process has to be, to some degree, subjective. Okay, so the entire system really hinges on this one key idea, the rankable cause. See, not every single cause of death can make the list. To even be eligible, a cause has to be on a pre-approved list and follow some really strict principles. This is all to make sure the rankings are consistent and that we can actually compare them from one year to the next. So, what are these big principles? Well, first off, the categories can't overlap. You can't double count anything. Makes sense. Second, any vague causes get tossed out. And third, and this one is really important, the selection is based on how important it is for public health. Finally, the rankings are based on the raw number of people who died, not the death rate, because they want to show just how frequent these causes are. I love this analogy because it makes it so clear. Think of a rankable cause like a music genre, something broad like accidents. Then a specific cause is like a single song within that genre, like motor vehicle accidents. Now get this, the CDC points out that on its own, motor vehicle accidents would only rank 13th. But because it gets bundled into that bigger accidents genre, it helps push that category right into the top 10. Now this standard list works pretty well for most of us, but it just doesn't fit every situation. Take infants under 1 year old. For them, the CDC has been using a totally separate ranking system since the 1980s. They have to do this to properly account for conditions that are specific to that incredibly fragile time right around birth. And here's what that special list looks like. For 2023, the #1 cause of infant death is congenital malformations, making up almost 20% of the total. That's followed by low birth weight, SIDS, accidents, and then complications for the mother. When you put them all together, those 5 causes alone account for over half of all infant deaths in the United States. So these are the official numbers, the big picture for the entire country. But when you look at a top-level list like this, you just have to ask yourself, is that really the whole story?
Because the short answer is no, not even close. The real power of these statistics isn't just in the big headline numbers. It's in what they reveal when we look a little closer. It's in the stories that are hidden in the gaps.
When we break that same data down by race, a completely different and frankly devastating picture emerges. That overall rate we just saw, it hides a terrible reality. In 2023, the death rate for white infants was 4.5 for every 1,000 live births. For American Indian and Alaska Native infants, it was 9.2, nearly double. And for black infants, it was 10.9. This is the point that just stops you in your tracks. An infant born to a black woman in America is more than twice as likely to die before their first birthday as an infant born to a white woman. Let that sink in for a second. More than double. And this is not some new problem. A KFF analysis points out that these gaps, these disparities, have been around and in some cases have gotten even worse for over 100 years. So what on earth is driving this? Well, research points to this really complex web of factors. Things like social and economic inequities, unequal access to healthcare, the chronic stress that comes from that, and systemic racism and discrimination that can affect the quality of care people receive. And this issue goes beyond infants. It's deeply connected to the crisis of maternal mortality. According to the CDC, a truly staggering 87% of deaths related to pregnancy in the U.S. are considered preventable. 87%. That means almost 9 out of every 10 of these deaths did not have to happen. And the data lets us get even more specific. In a review from 2020, discrimination was listed as a contributing factor in 30% of maternal deaths. This is where abstract ideas become tangible, life-or-death realities. So, this brings us right back to where we started. Understanding the rules of how we count is the first crucial step, but the real value is what that counting allows us to see. It's how we move from just raw data to real human understanding. Because those top 10 lists we see everywhere, they are not just a simple ranking of numbers. They are a carefully constructed lens, built with very specific rules, all designed to bring our biggest public health challenges into focus.
And when we look through that lens, we can finally start to see the profound and sometimes painful stories hidden just beneath the surface of the data.
Because what this all shows us, in the end, is that statistics aren't just abstract data points on a chart.
They're a mirror that reflects our successes, our challenges, and the deepest inequities in our society.
And that reflection forces all of us to ask the most important question of all. Now that we've seen it, what are we going to do about it?